Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
A year after launching the Postal Service Health Benefits Program, the Office of Personnel Management is facing critical resource shortfalls that threaten its ability to sustain operations. An Inspector General audit warns that without urgent staffing and funding fixes, OPM may struggle to process enrollments, manage benefits, and maintain service for more than 800,000 postal employees and retirees during the 2025 open season. Here to explain what's at stake is the Group Chief, Community Rated Audits Group, OPM Office of the Inspector General, Matthew Knupp. Mr. Knupp, thank you so much for joining me.
Great to be here, and I appreciate the opportunity to speak about our work.
We have an important topic to talk about today, the Postal Service Health Benefits Program. The OPMIG has recently produced a flash report on this program. Tell us, first of all, what it is, and then second, why you're so concerned.
So to start off, we want to go back to when the Postal Service Reform Act was passed in April of 2022. So this was a massive undertaking for OPM. Essentially, they had to create the Postal Service Health Benefits Plan for postal employees and their dependents. So a big project for OPM with a January 1, 2025 start date. So because of the traditional way auditing works and looking back, we decided to engage in real-time oversight of the program. This allowed us to provide agile reporting and work hand in hand with the agency in order to provide immediate feedback, but also to correct issues as they became aware of them throughout the process. Through these, our normal work in terms of interviewing and reviewing documentation, we became aware of some concerns related to funding as well as staffing issues currently with the Postal Service Health Benefits Program.
So this program is really just a baby, a year old. And as you started to look at it, it was really in its first cycle. So what are the big issues that are coming forward?
In this report, we identified three main findings. The first one was related to staffing. And essentially we focused in the report on the data platform. And what we found was that through a loss of staff coupled with the hiring freeze, that the operational effectiveness of the data platform becomes at risk. Initially, OPM estimated that it needed about 11 staff to administer this data platform. And with a variety of hiring actions, only 3 staff remained. So there was a big concern there with the operational effectiveness of the program.
Can I ask you to follow on with that? What is the data platform and why is that so important to administering the total program?
Sure. That's a good question. So the data platform is essentially the centralized hub that essentially gets all the data from a variety of sources and, in a general sense, transaction-based for enrollment processing. So, new members, old members, when they select their plans, all this information is coming through the data platform in the hub. So it's a key cog in ensuring that the postal employees, their families are getting in the plans that they are selecting, and that the other agencies that interact with this data platform are getting the information that they need as well.
And OPM was in the process of staffing up to run this well, just at the same point as the Trump administration came in with hiring freezes and staff reductions. Is that what caused the disconnect?
The disconnect occurred just through a variety across government-wide. Yes, hiring freeze, and also, staff leaving. So when OPM initially assessed the program, like I stated, they had a certain number, and through a variety of hiring actions, the number was lower than that.
Okay. And so that was problem number one, right?
Correct.
What was
Correct.
problem number
Absolutely.
2?
Problem number 2 then kind of keys in on funding. So in March of 2025, the continuing resolution was passed. Initially, OPM was due to receive an anomaly of $24 million to administer the Postal Service Health Benefits Program. However, that language was not included in the final passage. So there was a shortfall there. And then OPM at the time when they were made aware was not contingency planning to account for that shortfall. So there's a big concern there with operational effectiveness and the ability to pivot when this money was not made available to them. We also have concerns with future funding arrangements. So one of our recommendations, and we'll talk maybe more about that, is to essentially guarantee a funding arrangement that would ensure that the Postal Service Health Benefits Program operates as intended.
With respect to funding, having OPM run this program was supposed to improve the Postal Service's financial position, right? And so it's kind of interesting that neither organization really has the funding to operate this system well.
Yeah, and I think we are aware, across the government changes are occurring, So when OPM was made aware, of this funding reduction, they should have immediately been working on, like I said, we call it contingency planning. It's a way to mitigate risk. So, single environmental factors do not hamper your ability to operate, but they should have been looking at other methods, potentially for either securing funded or maybe reallocating internal funding as necessary at the time.
I'm speaking with Matthew Knupp. He's the Group Chief, Community Rated Audits Group at the OPM Office of the Inspector General. Mr. Knupp, let's follow on with that in terms of the recommendations that you made when you issued this flash report. How did you suggest that OPM deal with the issues you raised?
Right. So what we did is we essentially tethered the recommendations to our findings. So the first recommendation was for OPM to immediately address their skilled personnel shortages, specifically within the Chief Information Officer's area, to ensure the data platform remains operational. Our second recommendation focused on OPM to assess available funding options and secure the funding to maintain a centralized enrollment portal and process. And then the third one we had was essentially for OPM to develop contingency plans to meet the Postal Service Health Benefits Plan financial and procedural obligations.
And OPM's response was generally, yes, we agree, but they didn't provide much in the way of specific remediation, did they?
Correct. So while OPM did not explicitly agree or disagree, they essentially only provided a narrative response. So they noted that they were adjusting staffing workloads and assignments. They also noted that they had identified efficiencies in contract or government-wide savings to apply as necessary, and then also working on a legislative proposal for constant funding. However, it was only a narrative response. So from our end, there was not enough evidence there to effectively comment on whether this would address the issues at the time.
Well, we're about 2 months on from the report. Have you seen any definitive actions in OPM to specifically address these issues?
So at this time, we are working through our normal process. And what that entails is working with the agency. We work with an audit resolutions process, essentially that we work with the agency to assess any documentation, any work plans, any additional, background that the OPM officials may have. And through that, we will either agree or disagree with closures. And as we go through that process, we will issue public comments on that throughout a variety of our standard reporting.
This all really happened at a really challenging time. I mean, the middle of an administration transition when you have acting folks in positions of responsibility. Now that OPM has a confirmed director in Mr. Cooper, has he said anything about this program, or are you seeing more deliberate attention to resolving some of the issues?
So as I said, we're going to continue to work through our proper channels and kind of go through our audit resolution and compliance process to essentially close or keep open these recommendations. I think OPM's response, as you alluded to, they didn't explicitly agree to disagree, but they did stipulate that they were, making changes or at least aware of the issues and trying to work to address them. So we'll continue to monitor that going forward and hopefully get some corrective action on that.
Given the state of the system right now, it's the end of August, coming up on open season fairly shortly. What does this mean for folks who may need to enroll or change their status in the Postal Service Health Benefit Program?
Right. So I think we note throughout the report that there is now an elevated risk of operational failure at some level due to the lack of resources here. So what that could mean, again, we're just talking about risk. That's the environment we operate in. But what it could mean incorrect information being displayed for Postal Service employees and their families trying to select plans because the data platform isn't, getting the information correctly and displaying it correctly. But ultimately, it could even go up to, people not being able to access their benefits because their transactions are not able to be processed. And that's like probably the worst case scenario. But the reality is if the data platform is not functional, enrollees can't select plans, and then ultimately they are not able to, receive the health benefits that they are trying to select.
And so will there be a reporting mechanism or a complaint mechanism for those folks? If this isn't resolved in time, how will they make sure that their issues are raised?
Sure. So OPM and USPS have a variety of methods to communicate, for this program. There's, obviously the normal emails, the phone numbers, a variety of mechanisms to file either, I hate to say complaints, but, their concerns or reach out to, almost like a help desk. If possible, could I bring up one last thought on this?
Absolutely.
So while this is kind of narrow and focusing on the United States Postal Service, and that's a huge service with 1.7 million members, there is a concern here related to the FEHBP, the Federal Employees Health Benefits Program. OPM for a long time has had a decentralized enrollment process, and they've always spoke about modernizing that process. So this was an opportunity to do so. This is almost like a test case to kind of push forward into the 6.5 million members in the future. So if the operational effectiveness is not, funded and staffed properly here, there's a concern that that ability to expand in the FEHPP is not going to happen. And that's a big concern because OPM itself notes that there are, improper payments totaling around $1 billion per year. So this centralized enrollment system would at least allow a better control environment to potentially mitigate those improper payments that OPM itself identifies.
And there's many more millions of people in the FEHB program than there are in the Postal Service program.
Absolutely. We're talking at least a 3 times scale up on that.
Got it. Well, Mr. Knupp, I appreciate you bringing this report to our attention, and we'll hope that OPM and you all see effective resolution before open season. I've been speaking with Matthew Knupp. He's the Group Chief, Community Rated Audits Group, OPM Office of the Inspector General. Thank you so much for joining me.
Thank you, Terry. I appreciate being here.
We'll post this interview at federalnewsnetwork.com/Federal Drive. Listen to the Federal Drive on your schedule. Subscribe wherever you get your podcasts.